I'm sure when you had your child, you never realized how interested you would be in pooping and peeing. Most parents don't realize how much it will start to drive them crazy when their child goes even 6 hours longer than they expect without having a bowel movement. Of course, infants, especially breastfed infants, stool very frequently, and constipation is not a really common problem in the early newborn period. But around the time of toilet training, it's something that we see a lot. I have a lot of parents who come in with concerns about their child suddenly not being able to have bowel movements the way they could before. It's also common around the time of milk introduction. I see a lot of children who, right when whole milk is introduced, have about a week where they have a little bit more difficulty stooling. Usually what I find is after about a week, they'll just grow out of that as their body adjusts to the whole milk. But let's talk about what to do if your child is constipated. So again, really common for kids to develop constipation around the time of toilet training, and it's usually because they're scared. And I have to be honest, I don't blame them. If you think about a toilet, it's not that scary to us, but if you're two, it's as big as you are, makes a ton of noise, and everything you stick in it disappears. So if I were two, I'd probably be terrified of it also. So it's really normal when you're trying to encourage your child to toilet train that they don't want to tell you that they actually have to have a bowel movement because they're afraid to go on the toilet. And so they will retain the stool, hold it in, not tell you. It's that typical like goes into the corner and hides story that you'll hear. Unfortunately, what happens over time is the body continues to extract water from that stool that they retain, because that's the colon's entire job. Your large intestine, basically, its whole job is to absorb water out of your stool and make what we think of as a normal bowel movement. Unfortunately, the colon is sort of an automaton. It's a little bit of a machine, and it doesn't really know if what it's dealing with is new stool or old stool. And so when children retain, the body continues to absorb water out of that old stool, leading to, for any of you parents who have constipated kids, you know those big, huge, hard rocks that you can't imagine coming out of something that size. What then happens typically is, at some point, the child will have a bowel movement, but it's so large and so firm that it makes it incredibly painful to go. Sometimes kids can even have small tearing, or we call anal fissures, tearing of the skin around the anus, have a little bleeding. That makes them get into this horribly vicious cycle where now they were terrified to go, they stool with hold, they have a really large bowel movement, it's really painful, and now they're really terrified to go. So the next time, they hold it even longer. And again, it creates this vicious cycle where they suddenly have this large amount of old stool backing up in the distal colon or rectum that's difficult to get out. Sometimes, over a long period of time, what will happen is new stool that's forming will start to actually leak around the old stool. So it'll seem to parents like, well, actually, most of the time their bowel movements are really soft, or even softer than I would expect. And then once in a while, they have a really large, firm one. Well, those kids are usually very constipated. It's just that new stool is coming kind of down the chute, leaking around the old impacted stool and getting into the diaper or the underwear, or they're actually sitting on the toilet and going. So what can you do for children who are constipated? Well, the number one thing I tell parents, and we'll talk a little bit about potty training, is never force your child to use the toilet. Absolutely, you want to encourage them. Lots of bravos, yays, anything when they want to sit. But you never want to force them. So if you put your child on the toilet and they start screaming to get off, you just let them get off and let them go in their diaper. Because if you force, again, you'll start to kind of encourage that withholding behavior. They'll be afraid to tell you they have to go, or afraid to have a bowel movement because they'll think they're going to be forced to sit on the toilet. So it's the one place in life where I tell parents, like everywhere else, you, the parent in charge. When it comes to the toilet, the kids are in charge. So number one, encourage but never force. The second thing we need to do is we need to start relieving that obstruction. So for children I have who are very, very constipated and have a lot of backup, I actually need to start kind of unplugging the pipes from below. So I will recommend usually a small pediatric enema on 2 sequential days. And you can talk to your doctor about whether your child is at the point where they're constipated enough that they would need an enema. For a lot of my kids who are in the mild to moderate constipation range, they have firm stools, they're uncomfortable and it's hurting, but they're not very, very backed up. We can usually just start kind of treating from above. And the best medication that I find for constipation, and what's used by most pediatric gastroenterologists, is what we call Miralax. It's a powder. You can get generic version. The generic name is polyethylene glycol. It's exactly the same thing. And basically, the nice thing about Miralax powder or PEG powder is that it's not absorbed into the body. All it does is act as an osmotic agent, and what that means is it pulls water towards it, so it sits in the intestine and keeps the water in the intestine to keep the poop soft. The other nice thing is that unlike some of the old treatments for constipation, it doesn't cause any spasming or pain. It doesn't make you have to go. Of course, we don't want kids to feel uncomfortable or feel any spasms in their intestine. That's not a nice thing for us to cause. So the Miralax nicely just sits there, holds the water, and then lets you have bowel movements normally. The goal with Miralax is for children to have just normal, soft stools. Their bodies will not get acclimated to it or accustomed to it where they rely on it. Actually, if anything, treating with Miralax for the appropriate amount of time will actually make it so the children can develop normal bowel habits and go on their own. Over a significant period of time of constipation, the distal rectum, so the area of the large intestine just before everything comes out, actually can start to distend. So the walls can stretch out and kind of lose the normal sensation that they're supposed to have to tell you to go. So that sensation we get when we know we have to go to the bathroom, as those walls stretch out, you need more and more and more stool in there for your body to send signals, hey, it's time to go get on the toilet. So it takes a very long time for that to go back to normal. And it does go back to normal. Those walls will kind of get back down to a normal size, and the nerves that innervate them will develop a normal sensation about when to go. But it can take months and months and months of treatment, months of normal stooling, and months of not having that area backed up for that to happen. So what I tell parents typically is to start Miralax powder, depending on the age of your child, their weight, and how constipated they are. It's usually either a half of a capful of powder up to 1 full capful of powder 1 to 2 times a day. It's got no flavor, so kids don't know they're getting it, so it's pretty easy to give to them. You could put it in any fluid you want. Obviously, the ideal would be in water, because giving them water with it will help, again, retain that water in the stool and keep the stool soft. You can talk to your doctor about what the right dose is for your child. And what I tell parents is stay on the dose that works. So whichever dose you're using that gets your child to have a nice, soft bowel movement once a day without straining, that's their dose. A lot of times what I see is parents are told to start Miralax, but as soon as the child starts having a normal bowel movement, they stop it, and unfortunately, they stop it too fast, and the kid becomes constipated all over again. So what I tell parents is, when you see normal soft poop, that's your dose. You're going to stay on that dose for a few months, unless they start to have stools that are too loose. So they're getting diarrhea. That tells you that, hey, things are starting to move in the right direction and I can back off on my Miralax. So you might take a child who initially was on a full capful twice a day and go to a full capful once a day. If they're still too loose, then you cut to a half a cap once a day or every other day. And I basically tell parents the only time I'm ready to stop is if I'm giving them Miralax on Monday and they're having diarrhea for a week. Then we know things are better and they don't need the Miralax anymore. But again, it can take 4 to even 6 months of treatment to get to that point. The important thing to remember is, again, your child's body won't get used to the Miralax. The Miralax actually will help them develop normal stooling patterns on their own. It's not absorbed into their body, so it doesn't create any systemic effects, meaning it doesn't change their liver, their kidneys, their heart, any of their hormones or anything like that. It doesn't affect their growth. It doesn't give them spasms. And for the most part, what I find is for my children who get improved, they start developing a comfort with using the toilet. They're no longer afraid of stooling. And within a few months, you've got a kid who's not constipated, is toilet trained, and is doing very well.
Medtwice.com